Welcome to another episode of Midnight Mental Talk. I am Adrienne, and this is my co-host. I don't know where she is. Leanne. I think she's over there.
Yes.
This week's topic is actually we're going to be discussing anxiety, and as you probably saw at the beginning, I displayed a little bit of it. What would you like to start with?
Well, I want to start with one of the main statistics that I've read about anxiety in general, which is that it affects about 12% of Canadians and in any given year. And statistically speaking, as a group, anxiety disorders represent the most common of all mental illnesses.
It's definitely common in the sense that everybody experiences on some level, and it just depends on how you deal with it, if it becomes disordered or if it's just, something that is just a general thing that, you can actually successfully walk your way through it, or if your mind can actually start, playing games on you and tricks on you like any other disorder.
I know, we could be talking about a simple thing as being afraid to make an important phone call, to not being able to walk into a restaurant because you literally throw up.
Mm-hmm.
So, that said, Adrienne, why don't you tell us about these 6 main types of anxiety disorders that we know about?
Okay, I will quickly go over the 6 that they have come up with. The general anxiety disorder, which is an excessive anxiety and worry about a number of events or activities occurring for more days than not over a period of at least 6 months. So something like you're worried about simple little things about going to the grocery store, and it's something that nags at you every day. So you end up worried about it and concerned about it, so you just, even though you try and refocus yourself, your mind keeps going back to that. There are associated symptoms with it, such as fatigue and poor concentration.
Mm-hmm.
Obviously, you can't focus. There's specific phobia, which is marked and persistent fear of clearly discernible objects or situations, such as flying, heights, and animals. A lot of people have fears of flying and heights. It's not uncommon. Post-traumatic stress disorder, which is very common, and it's actually something that as well is not being discussed as much. It's kind of like it's on the back burner because it's not believed to be true, and that people are just overreacting. And what that is a flashback of persistent frightening thoughts and memories, anger or irritability in response to a terrifying experience. You take people who come back from Iraq or even World War II, and they sit there and they remember, or they have nightmares, remember all the bad things that happened, and they just can't get past that because it's crippling to them. So this is actually a lot more common, and it should be brought forward a lot more because this disorder causes a lot of suicides as well. Mm-hmm. Social phobia, which is also known as social anxiety disorder. I know quite a few people that suffer from this, and it's essentially you can't go out there in a social setting. You can't go to parties, meetings, or even sometimes going to work can be a problem. There's also obsessive-compulsive disorder, which it's the obsessions is persistent thoughts, ideas, impulses, or images that are perceived as intrusive and inappropriate and that cause marked anxiety or stress. I'm going to use myself as an example as much as I don't want to. I had this weird thing about locking my car door. I had to do it 3 times before I accept the fact that it's locked. Mm-hmm. It doesn't consume me, but that is an obsession. And then with our front door, I do the same thing with my front door. So, but I don't let it control me. It might control me for 5 minutes, but it doesn't control me after I leave the house. Mm-hmm. The other part of that is the compulsion, which is the repetitive behavior such as hand washing, ordering your things, or checking, which is the car door or the front door, and mental acts such as praying, counting, or repeating words that occur in response to an obsessive or ritualistic way. There is panic disorder, which is anxiety attacks and panic attacks. Presence of recurrent unexpected panic attacks followed by at least 1 month of persistent concern about having an additional attack. If you are at the grocery store and all of a sudden you have this overwhelming sense of fear, you want to leave the grocery store. You leave the grocery store because you're afraid that something bad is going to happen, even though there's no threat at all that something bad is going to happen.
Okay.
And the problem with the situations like this is if somebody doesn't recognize what it is, they will spend the time avoiding the grocery store, which eventually will create a snowball effect. So you may not end up leaving your house, or you may avoid the grocery store. You may find somebody else to do it for you. Mm-hmm. Some of the symptoms for that is palpitation, increase in heart rate, or pounding heart, which sometimes mistake that as a heart attack. There's sweating, trembling, or shaking, and the sensation of shortness of breath or smothering.
Sounds lovely.
Yeah, doesn't it? There's actually a lot more as well. There's the fear of dying, the dizziness and nausea, chest pain, which, like I said, the fear that you're having a heart attack.
Okay.
Chills and hot flashes. Mm-hmm. So basically, a panic disorder plays on the fight or flight response. Mm-hmm. But instead of staying and fighting it, you flee. And there's agoraphobia, which is anxiety about being in places or situations from which escape might be difficult or embarrassing. Okay. Or in which help may not be available in the event of unexpected contextually cued panic attacks or panic-like symptoms. The best way I can describe that is people who have agoraphobia, the best example I have is going to movies. Okay. If they go to a movie theater and they can't map out an escape, they'll leave. Because they're scared that if something might happen, that they might not be able to have a clear route. Or like if you're in a lecture hall, that's another example. Universities have massive lecture halls. They hold like 300 people, right? Mm. So if they don't have a clear escape to get to the door, then they may not go to class.
Okay. So another one is childhood anxiety, which includes separation anxiety disorder. And those symptoms can include following a parent or parents around, not letting them out of their sight, being excessively afraid of sleeping over at a friend's house, or refusing to go to camp or school, requesting to have someone with them when they fall asleep, or get into the parent's bed in the middle of the night, or not wanting to, or avoiding going to places alone. And now, those symptoms I got off of the anxietycanada.ca website. I just want to make note of that because I did read it pretty much word for word. The social anxiety disorder for children that may cause them to avoid situations where they may have to engage in activities that make them feel anxious. And I guess that's similar to what you described for adults as well. School performance and attendance, as well as child's ability to socialize with peers, develop relationships, can suffer as a result of anxiety. And some symptoms of social anxiety, as listed on this website, is feeling intensely afraid of and or avoiding social performance situations, initiating conversations with peers or teachers, speaking in front of the class. Who really likes to do that? Come on. Inviting others to social activities and participating in peer-orientated activities like sports and parties. There are also physical symptoms of a social anxiety disorder, which can include dizziness, stomach aches, racing heart, sweating, and crying. And then for children, we do get into the obsessive-compulsive disorder, the generalized anxiety disorder, and all the same ones you did list as an adult. For the most part, the symptoms are very similar. But it just goes to show that children can be severely affected just as much as an adult with anxiety.
There's one thing that I had learned, I could be wrong, but my memory serves me right, with childhood anxiety and OCD, they say if your child starts displaying symptoms of OCD, you should not actually pay attention to it. Okay. But if it becomes severe, you obviously have to pay attention to it and you have to get your child help. But what they say is that if you focus on the negative aspects of the OCD, then eventually it will develop into something much bigger. So if your son or daughter is like putting things in a certain order, like their blocks have to be in a certain order, or their dinosaurs have to be in a certain order by size and whatnot, that there's nothing really wrong with that. But if you, sort of like play into it and say that it's just weird, and they overhear you, it can become something. Okay. So you just kind of have to be careful. I know it sounds kind of weird, but if my memory does serve me correctly, if I'm wrong, somebody please tell me. Like, I will totally admit that I'm wrong, but I did learn this when I was at school, and it's something that I had actually pushed a lot of times with people, because they're just like, no, don't engage into it. But I definitely could have been underneath the category of childhood anxiety because I was a shy kid.
Mm-hmm.
And I know that people who know me now don't believe me. Like, they don't. They don't. I had this conversation with coworkers and they don't believe me. From what I remember, I used to hide behind my mother's leg and to avoid it certain situations. I did T-ball when I was a kid and totally made fun of at one point, so I just never went back because I associated that moment with, so I ended up getting anxiety about it, but yeah, no, it definitely happens. So I guess you kind of have to be very encouraging to your child, obviously, but also support them when they are having a problem and maybe try and help them get through the situation, because if not, then it could snowball into something else.
When you're a child, I think it affects you more greatly than when you're as an adult. So when you're 30, we can understand it and talk about it and think back and realize, oh, that's what triggered that, and that's what...
Yeah.
But what advice would you have for children who may be watching this, or teenagers, or parents who are sitting at home not doing anything about it right now?
And the child is having a lot of concerns about anxiety?
Yeah.
You can always go to a child psychiatrist.
Mm-hmm.
They could very well help you and guide you. You could also very well ease them into situations slowly, not like dramatically be like, oh, hey, you're going to this party and you're staying there and I'm leaving right now and I'm never coming back. Like, I guess in a sense that if you take your child that has the social anxiety and you take them to the party, you stay and you reassure them that everything's okay, and then you're just totally weaning yourself out of the picture as long as you know that they're having fun.
Mm-hmm.
But make sure, I guess, kind of still stay in the same line of sight, I guess you can call it.
Okay.
It's a lot of times it could potentially be something that they will grow out of because children are really shy. They're just really unsure. I would definitely get them into groups of, make sure they're in a lot, well, not a lot of groups, but they have peers around.
Mm-hmm.
I find that people that tend not to have a lot of peers are shyer because they just don't know how to act and respond to other kids. Like, oh, that kid's over there talking to me. I know. No, I'm going to hide over here under this table because this is totally acceptable.
Right.
But if you really are stuck, then I would definitely do the research and I would definitely probably go to the child psychiatrist or child therapist, and there's nothing wrong with that. It could only be like one session and that's it.
And what advice would you have for teenagers or children watching whose parents don't want to treat them, don't want to have anything to do with it, and are ignoring the situation?
Then the parents need to accept that there's a problem, for one. And most teenagers, they are able to go to their family doctor and get help by themselves.
Okay.
Like if you're really full of anxiety from any social aspect, you have a panic disorder, an OCD, and you recognize the fact that it's controlling your life, then I would definitely speak up to your parents. I would definitely speak up to maybe a school counselor if you need to, or somebody else that you trust. And then that way they can guide you in the right direction of where to go to get the help. And I know that's going to cause the anxiety, but once you get through that, then everything, all the steps will fall into place. Okay. You're totally okay. You're not the only person in the world that deals with anxiety for sure. The percentage was low, but everybody deals with it in some fashion or another.
And for treatment options, do you have them in front of you?
I don't think so, but I think one of the things that actually probably came up from the last stuff we were talking about, and that was the cognitive behavioral therapy.
Correct, and along with pharmaceutical treatment. Those are the two recommendations that I read about. They could either be one or the other, or they could work hand in hand, is my understanding.
Yeah. That is very, very true. If with anything, you have to be properly diagnosed first. And then once you're properly diagnosed, and then you can continue to go on. You can't just go to your family doctor and be like, I have anxiety, and they prescribe you some yellow or green or purple or rainbow colored pill that will make everything better.
I hope a doctor doesn't do that.
It's not uncommon, and I have strong opinions about that. Family doctors should not be prescribing meds unless they have a background in psychiatry.
That could be our next topic, the types of doctors compared to psychologists, psychiatrists, therapists, and who should be doing what and who you should be contacting to do what.
Exactly. Yeah, there you go. Tune in for next week because that's what we're going to be doing.
Cool.
The only thing that I actually really have to say is that it's going to be more common for women to have anxiety disorder than men. But the only reason for that is because men tend to not go and explain that they have the anxiety disorder. Um, don't be ashamed of that. If you're a male person who has anxiety disorder of any description, like, don't be ashamed that you have it or you are experiencing it, because there's nothing wrong with that. It's better for you to go and get the help for the anxiety disorder or the panic disorder, because chances are you may very well be right now self-medicating to deal with it. Women are more likely to go ahead and get the help because there's the stigma of men. It's not very manly for a man to have some sort of disorder. So shoo that out of the garbage, put that in the garbage, put it on the roadside, and let it be picked up next garbage day, and go get yourself some help, because you're totally worth that.
But before we go, I want to remind everybody to click subscribe, like, dislike if you hated it, and comment below on any issue that you'd like to see us talk about or give you information about. And feel free to email us or reach out to us via Twitter. And so, it was a pleasant chat with you again tonight, Adrienne, and we're going to do it next week.
Absolutely. And it'll be a little more organized.
Okay.
And a little less hot mess.
Alright, sounds good. Bye for now.
See you later.